Hey everyone, it's Dr. John Burroughs. I wanted to briefly discuss something that can be very serious and oftentimes fortunately treated. We're going to look at a case of a vascular occlusion of the right facial artery that resulted from hyaluronic acid being injected with a 27 gauge cannula in a poor fashion. I like to present one of my international meetings just coming up, had to be canceled due to the recent pandemic, but I wanted to share this anyway on my YouTube channel. So, when it comes to the aging of our face, there's 4 Ds I like to think about. There's the descent from gravity, deflation from fat loss, degenerative skin changes, and distortive bone changes. There's several buttresses in the face, as shown on the slide, that if you can rebuild or reinforce with fillers, can really help with those aging changes that we see. Now, fillers are great because fullness is a sign of youth and health. These fillers can fix fine lines and fine folds, as well as fix large areas of fat deflation and even mask fat bags under the eyes and even sags in different parts of the face. There's different types. The most commonly used are the hyaluronic acid fillers. I call these the sugar fillers because what they're constituted by. The calcium hydroxylapatite filler, which there's Radiesse. There's Sculptra, which is a polylactic acid. And then there's some permanent fillers. And fortunately or unfortunately, hyaluronic acids are the only ones that are reversible. It'd be great if we had other filler types that would be. So any injector needs to have a very good appreciation of the vessels in the face. I call this vessel awareness, kind of like fighter pilots who fly in formation have to have great situational awareness. So in this case, I'm going to quickly show you. You can see this is the facial artery running in here, and a lot of injectors will be injecting along that area to reduce the nasolabial folds. Now, when it comes to injecting, cannulas can be safer than needles, but not all cannulas are treated equally. It's been found in a study that the 22 gauge cannula is definitely safer than most of the needles. In a study, it could not be pushed or forced its way through into an artery, whereas the cannulas that were 25 gauge, 27 gauge, or higher acted just like needles, so you might as well not even use cannulas of that size. Now, another nice part about cannulas is that once they're under the skin, they tend to move through the skin in a more comfortable manner for the patients. It can also give less bruising and swelling, and that's a great benefit. And I think those that want to learn how to use them well are serving their patients very well. So again, on the cannulas, there's multiple companies that make these. I like to use the 22 gauge 2-inch in the face because a lot of times you can inject larger areas just with a single site of entry, which can reduce the infection risk, and it also reduces the discomfort for the patient not having to go in so many sites. So here's the case. This was a patient referred to me because of the situation that you can see in the slide here. She'd had filler placed in this area as well as down in here, but this was the area of the occlusion. A 27 gauge needle was used, 27 gauge cannula, but again, it acts just like a needle, and the person that was doing the injection did not realize this, unfortunately. When that filler got into that vessel, it caused this whole area of blanching here to no longer get the blood flow it needed. So just like when you're having a heart attack, if the blood flow is not going to the right parts of the heart, this causes chest pain and discomfort. Well, in the face, it can also cause discomfort. Another telltale sign is that the bruising is irregular and kind of splotchy with areas of significant pallor. You can also get a small area of crusting and necrosis, which you can see right here. So fortunately, this patient got to me within about an hour and a half, and I went ahead and flooded the area with hyaluronidase, which is that enzyme I talked about earlier that can reverse hyaluronic acids. Now, you unfortunately have to put quite a bit of this enzyme in to get the restoration of the blood flow, and you can't always. So that's why it's so important to try and avoid these to begin with. Interestingly, as soon as this area had been flooded with the enzyme, her she started getting color back very quickly, and her pain almost resolved within a few moments to a few minutes. So here's another view as she first came in, and this is immediately after the injection of the enzyme. You can see some color coming back, and very important indication that the restoration of blood flow had occurred. Here she is a few days after that injection. You could see where she had a focal area of the skin necrosis, and here she is a month later. Looks good, however, she's still going to have that area, which will probably leave a small permanent scar. It is, however, excellent and fortunate for her that the restoration of blood flow is much quicker, because I've seen photographs and patients presented at meetings where they have large areas where the skin sloughs off and it causes permanent scarring. Now, another quick thing I wanted to mention about fillers is you want to get them done in a clean environment. Make sure the skin is prepped well. Alcohol is okay, but better is betadine or chlorhexidine. Chlorhexidine is amazing because it kills bacteria within seconds, whereas betadine, for its full effect, you need a few minutes. Alcohol is good for wiping off makeup and kind of oils and things, but it doesn't really disinfect the skin as well. Now, chlorhexidine is toxic for the eyes, but for the other areas of the face, it's quite fine. This lady was a different patient referred to me, and she had been on a cruise recently in the Caribbean and just thought it would be nice to get filler placed in this area. So she did, and I wasn't there, but I assumed the environment was not very clean. She probably didn't have her skin antiseptically clean, probably just a little bit of alcohol. And these injections of any of the fillers are like a implant, and implants can get infected in any part of her body. And that's why if you have like a total hip or total knee joint replacement, that they use antibiotics in an extremely sterile environment. So this lady had bounced around for several months, as she didn't even live in Colorado, and kept getting these red painful nodules that would express purulence now and then. And so you can't just throw antibiotics at this. It's not going to completely take care of it. Here's a syringe showing about a cc and a half of purulent material that expressed when I first met her. So I went ahead and put her on antibiotics that cover atypical bacteria, because that's one of the high risks of these infections. And so Bactrim works well for that, and there's others. I also flooded the area with hyaluronidase so the antibiotic that she was taking could get into the area, and this also helped dissolve the filler so it could be absorbed and cleared out of her system. So another interesting thing about these enzymes, the hyaluronidase, is they don't always have to be used for emergencies. And I've termed filler sculpting for when you can take filler that was placed too much in one area or caused some swelling in one area, say it's elevated like a mound, and then you can flatten it out a little bit but not lose the whole effect to where you still have that big fold that you're trying to address. So this works amazing for that. There's certain protocols and things I could discuss on a later video, but you don't use the full strength. You dilute it down, and you have to place it very carefully. One interesting point to be aware of is that the different hyaluronic acid fillers, though they will dissolve from hyaluronidase, some take more than others. Some take a lot. Restylane, made by Galderma, is one of the ones that's easiest to dissolve, takes the least amount, and then there's in between. And unfortunately, the Juvederm family, which produces amazing results by Allergan, their newest ones, like the Velour, Volbella, and Voluma, take a lot more to dissolve. So that can be an issue for patients when there's a problem that occurs. So again, the enzyme's good if you have an infection or nodules, which can occur with fillers on occasion. So some of the take-home points are that you always want to have filler injected in a clean environment, and make sure the person that's injecting you cleans the skin and even antiseptically cleans the skin. Alcohol is really not enough, in my opinion. You want to be sure your injector is qualified, and that if they're not a physician, that they have a physician medical director that's available for medical emergencies. And these occlusions, usually they're going to occur right away, but sometimes the symptoms aren't clear to the patient or the injector for an hour or more, and they need to be addressed quickly. Just like when you have a heart attack, you don't sit on it for days. You need to get into the emergency room to get treatment. The enzyme amounts you need can be quite substantial. That one case I went over took 6 vials, which is a lot, but scarring that could be permanent, and prolonged ischemia or lack of blood flow to the area, that's a serious thing. So it's worthwhile to have a lot of the enzyme always available. And if you're getting injected in a new spa or physician's office, you really want to ask, do you keep enzyme available? Because if they don't, that's a real warning sign. Even though filler complications are rare, they do occur. And if it was your skin, wouldn't you want to be sure you have um, the injector having the ability to inject you with enzyme as soon as possible? We already covered proper skin antisepsis, and the large cannulas are the very safest, like the 22 gauge, and there's also a 23 gauge. But once you get to 25 gauge, 27 gauge, or higher, there's a false assumption because it's a cannula and not sharp like the tip of a needle. It's such a small caliber, smooth tip that it still acts like a needle and can get into the blood vessels. And then the last thing is, if you're being injected at an office or a spa, you need to be sure that if there's contact that you can do after hours, to be sure you can get the treatment you're needed. If you go to the emergency room, these enzyme compounds are not always readily available, whereas the place you get injected, they should always have it on hand. If they don't, I don't think they should be injecting, and I just don't think it's good care. So thanks for tuning in. I hope this was helpful, and hope everybody is doing well and having a great day. Thank you.